In the field of artificial intelligence and mental health, one major challenge is the scarcity of data for training systems, especially when it comes to sensitive topics like trauma treatment. This paper, titled "1,000 Voices of Trauma," addresses that gap by introducing a large-scale synthetic dataset designed specifically for modeling conversations in prolonged exposure therapy, which is an evidence-based approach for treating post-traumatic stress disorder, or PTSD. The dataset is called 1,000 Voices of Trauma, and it consists of 3,000 simulated therapy conversations. These are based on 500 unique cases, each broken down into 6 different conversational perspectives. These perspectives reflect the key stages of a prolonged exposure therapy session, as outlined in established clinical protocols. For context, prolonged exposure therapy helps patients confront and process traumatic memories in a controlled way, aiming to reduce the distress associated with them over time. To create this dataset, the researchers incorporated a wide range of elements to make it as realistic and diverse as possible. They included demographic profiles spanning ages from 18 to 80, with an average age of about 49.3 years. The gender distribution is balanced, with roughly 49.4% male, 44.4% female, and 6.2% non-binary participants. This diversity is crucial because real-world therapy datasets often lack representation across different groups, which can lead to biased AI systems. In addition to demographics, the dataset covers 20 different types of trauma and 10 trauma-related behaviors. Traumas include things like witnessing violence, which appears in about 10.6% of the cases, or experiencing bullying, which shows up in around 10.2%. Common symptoms modeled in the dataset include nightmares, affecting 23.4% of the cases, and substance abuse, seen in 20.8%. These elements were generated using a combination of deterministic methods, which follow strict rules for consistency, and probabilistic methods, which introduce variability to mimic real-life unpredictability. The structure of the dataset is particularly thoughtful. Each of the 500 cases is divided into 6 phases that mirror the progression of a typical prolonged exposure therapy session. The first phase is orientation to imaginal exposure, where the therapist helps the patient prepare to revisit their traumatic memory in their mind. This is followed by the imaginal exposure duration, where the patient actively engages with the memory, often experiencing peak distress. Next comes monitoring SUDS ratings, which stands for Subjective Units of Distress Scale, a way to measure the patient's anxiety levels during the session. Then, there's reinforcing comments, where the therapist provides encouragement and positive feedback. After that, the phase involves eliciting thoughts and feelings, encouraging the patient to express what's coming up for them. Finally, the processing the imaginal phase helps the patient make sense of the experience and integrate it into their life story. This setup allows for 3,000 distinct conversations in total, as each phase can be analyzed on its own or as part of the full session flow. The researchers analyzed the dataset and found that it produces realistic distributions of trauma types and symptoms, which helps in evaluating how well AI models can handle the emotional nuances of therapy. To ensure the dataset's quality, clinical experts reviewed it for therapeutic fidelity. They praised its emotional depth but suggested some refinements to make it even more authentic, such as fine-tuning the language to better capture subtle human interactions. This validation step is important because synthetic data, while privacy-preserving, needs to be accurate to be useful. One of the key innovations here is the development of an emotional trajectory benchmark. This includes standardized metrics to evaluate how AI models respond in therapy-like conversations. For example, it can assess whether a model's replies appropriately guide a patient from high anxiety to more processed emotions, which is essential for training effective AI tools. By using synthetic data, this dataset sidesteps many of the ethical and legal hurdles associated with real patient data. Privacy regulations often make it nearly impossible to collect large amounts of genuine therapy conversations, but synthetic methods allow researchers to create high-quality alternatives without compromising confidentiality. This approach also tackles other common problems in mental health data, like incompleteness or inconsistency, and it ensures better representation for underrepresented groups, such as racial or ethnic minorities. In essence, 1,000 Voices of Trauma fills a critical void in AI development for mental health. It provides a scalable resource that can be used to build patient-facing applications, like chatbots that offer initial support, or tools for clinician training. For instance, AI systems could use this dataset to simulate therapy sessions, helping therapists practice or even assisting in real time during consultations. The paper highlights how this dataset promotes more effective and personalized mental health care by emphasizing diversity and ethical considerations. It's a step toward reducing biases in AI models, ensuring they can serve a wide range of people dealing with trauma. Overall, this work demonstrates the potential of synthetic data to advance trauma-focused therapy, making AI a more reliable ally in addressing PTSD and related conditions. As the field continues to evolve, datasets like this one could pave the way for innovative applications, from virtual reality exposures to automated monitoring of patient progress. By balancing representation and clinical accuracy, Thousand Voices of Trauma sets a new standard for how we approach AI in mental health research and practice.